All right, happening right now, Governor Hochul and Mayor de Blasio holding a news conference on the Omicron variant and its presence here in New York City. Let's listen in.
So I want to make sure everyone understands this is about unity. There's a reason we're here together to signal that this is a challenge that we're going to tackle together and ensure that everyone knows that we're focused on transparency, which means we'll provide information as we get it, as well as a coordinated response from the city and the state to deal with whatever lies ahead. As I mentioned this morning in my briefing, we still don't have specific information on how the vaccines are holding up or the boosters are holding up to this variant, but it is real. We said it would be coming here shortly. We announced this morning that a case from Minnesota was directly tied to the city of New York for individuals who participated in a convention at the Javits Center between November 18th and the 22nd. That individual has already recovered from their symptoms. They tested positive, but are already feeling well, and it was a very minor case, and that's something I want to put an exclamation point on. While this may be highly transmissible, at least from the early evidence, and again, more information is still forthcoming, we want people to know that the early cases that have arisen are not life-threatening. They seem to be minor cases, and that is a source of good news for us right now. But in terms of the information we received, literally there are 5 cases identified today in the state of New York. The first one was in Suffolk County. I've been in communication with the county executive, Steve Bellone, to alert him. This came out of a lab that is in Suffolk, and it was a 67-year-old female who had symptoms, mild symptoms of a headache and a cough. There is some vaccination history. We don't know if it's 1 vaccination, 2, or a booster shot, and that information will be shared with the public as soon as we receive it, but there's at least 1 vaccination involved. This is an individual who traveled from South Africa, who tested negative upon returning to the U.S. on 11/25, and on November 30th, they took a point-of-care test, and they did test positive. And Northwell sent the results sent the individual to a lab, and that person did test positive. Again, a traveler from South Africa who arrived here and is a Suffolk County resident, a 67-year-old woman. Our second case is a Queens-based. The vaccination status is unknown to know whether or not this person had been vaccinated or not. Third case, similar situation. No other further personal details, but the vaccination status is unknown, Queens-based. And another case is from Brooklyn, unknown vaccination status. And we just received word of another suspected traveler case here in the city that was identified in the city, and what's in one of the 5 boroughs. So we knew this was coming, Mayor. We talked about this. You and I have been in communication already. No cause for alarm. We just want to make sure that the public is aware of information when we receive it. We don't have more information at this time, but we suspect there'll be more cases emerging. And the best thing that everyone can do is realize we're not defenseless against this variant at all. That vaccine, we know, is going to ensure that there's less severe symptoms. The booster is something I would highly recommend. If you're not vaccinated, get vaccinated. If you have vaccinations, both series, get the 3rd dose, which is your booster. Ensure that our children are masked up, as well as making sure that they get their vaccinations, of anyone above 5 years old. And also recommend that people continue to wear their masks indoors, and when you can avoid large gatherings at this time. This is not a cause for major alarm. I need to say that, because we do not have enough information. We're not having shutdowns. We're not changing our protocols. We are continuing where we are, but making sure that we work in concert together and encourage people to get tested often, get the vaccination, and that, again, is our best defense. Again, Mayor, I thank you for the continued relationship that we've had since the beginning of my term. Short time, but a lot's been happening, and I appreciate your leadership as we work through these issues together.
Thank you so much, Governor, and thank you there's been tremendous communication, you and I directly, but also your team and my team. I want to thank you for that. A very cooperative, collegial atmosphere, a lot of unity of purpose, and I want to say that to all New Yorkers. We are working together to protect you. We have a new situation, but we also know there's a lot of information we do not yet have about Omicron. We know we now have cases here in New York City. We have to assume that means there's community spread. We have to assume that means we're going to see a lot more cases. But we also have tremendous tools, as the governor said. We have a massive vaccination apparatus, and that is by far our best capacity to protect everyone against this variant or any other form of COVID. So the message today is let's do the thing we know works with COVID. Let's get vaccinated. To all the parents out there of the youngest New Yorkers who have not yet gotten your kids vaccinated, the 5 to 11-year-olds, we need you to get your kids vaccinated right away. To everyone who qualifies for a booster and has not yet gotten it, we need you to do that to protect yourself and your family and everyone in this city. We know vaccination works. It limits the impact. We know this. It limits the impact of COVID. It helps reduce the spread of COVID. We need that more than ever. We are going to keep the public informed. The governor's made a commitment. I make the same commitment to transparency. We'll be constantly updating the public. But as the governor said, right now, the good news is there's a very strong healthcare team for the city and the state working to protect you, and that will be every single hour of every single day. As for what we learned about this conference at the Javits Center and these additional cases, our test and trace team is out there immediately, working with each individual who was affected to figure out who else they came in contact with. That contact tracing is absolutely crucial. We have the strongest test and trace team in America. Thousands of extraordinary committed individuals out there protecting you. They're going to make sure we identify who needs any support, anything in the way of medical support, quarantining, etc. Also, we're going to use every tool at our disposal. Earlier in the week, we announced a vaccine mandate for child care employees, about 102,000 child care employees. Earlier today, a vaccine mandate for employees of non-public schools. That's about 56,000 additional employees. Both of those go into effect December 20. There will be more new initiatives coming to protect people. The bottom line is we're going to use every tool at our disposal. Our healthcare team and Commissioner Dave Choksi is here with us for answering of questions. Everyone is committed to protecting all New Yorkers, and city and state working together in unity to get this done. With that, we'll take some questions. Stating the obvious, this is an urgent moment, on topic only. We welcome questions now from the media.
We'll now begin our Q&A. As a reminder, we're also joined by Health Commissioner Dr. Dave Choksi. The first question today goes to Emma Fitzsimmons from the New York Times.
Hi, good evening. So can you tell us all 5 cases here are believed to be mild, and only in the first case do we know that the person received at least 1 dose of the vaccine?
Yes, we only know.
And then Dr. Choksi, go ahead.
Yes, with respect to the information we just received from the labs, which is literally what happened within the last hour, we only know that 1 person has been vaccinated for sure, and that is the individual from Suffolk County. So that status is not determined. We expect to know it soon, and the symptoms were very mild. And again, we don't have a lot of cases to compare this to, but the individual from Minnesota, the first case that we spoke about today, again, mild symptoms, they recovered at home, and that is why we have to realize that this is actually the 5th variant. I thought it was the 4th, but we added up, it's the 5th variant. The Delta one that is still pervasive. We've had over 7,000 cases over the 7-day average, 5,300 cases statewide just yesterday from the Delta alone. And we don't know whether this is going to exceed that or replace the Delta variant as the #1 cause of people contracting COVID. So more information to follow, but we don't know the vaccination status of anyone other than the first one.
As I turn to Dr. Choksi, just emphasizing the governor's point, we do have a new challenge, but we have a much bigger current challenge with the Delta variant and driving a lot of real profound impact on families all over the city, state, and nation. So I just want to emphasize to everyone, job 1 is still dealing with the Delta variant. Dr. Choksi, anything to add on the cases so far?
Just briefly, sir, the governor and the mayor are exactly right. With those 5 cases, we are still gathering all of the details. We know that 1 of the 5, as the governor said, is vaccinated. It's very possible that others will also be vaccinated, but it gives us a chance to reinforce it's so important. If you or your child are not vaccinated yet, get vaccinated. If you are and you're an adult, get your booster dose.
Emma, do you have a follow-up? If not, let's go to the next question.
As a reminder, we're also joined by the Test and Trace Director, Dr. Ted Long. Next question goes to Jimmy Vielkind from the Wall Street Journal.
Can you hear me?
There you go. Yes, we can. Tape delay. Yes, we can.
Hi, Hi. So other than getting vaccinated, my first question is, other than getting vaccinated or boosted, if you haven't already, what adjustments to behavior, if any, are you recommending to New Yorkers?
Governor, would you like to start?
We're encouraging indoor mask use for sure. That is another way that people can have that extra layer of protection. But again, the boosters and the vaccination are the primary way to protect themselves. We don't have any evidence of other another variation of this that require a different reaction. For example, if you remember in the early months of the first pandemic, the first variant, COVID initially, people thought that it was transmitted by surfaces. And so it was all about making sure that we cleaned our hands and took other precautions. So we're learning more information. We'll get all that out. But right now it's exhibiting the same kind of traits that other variants have had. So we believe that the booster and the vaccination are the way to go. But we highly encourage people to wear their masks indoors.
Yeah, and Jimmy, just quickly to say, the governor and I are constantly reminding people how important it is to get vaccinated. I want to say, particularly with the holiday gatherings coming, with travel coming, anyone who's thinking of traveling on a plane, on a train, anywhere around other travelers, get vaccinated. It's more urgent than ever to do that. Dr. Choksi, you want to add?
Thank you, sir. Vaccination is the single most intervention, as has already been described. Beyond that, masking and testing are important, masking particularly indoors. And testing is important, particularly around travel or gatherings. Beyond that, there are common sense precautions that we have seen have worked over the past 2 years. Stay home if you're not feeling well, and that includes mild symptoms. And if that's the case, get tested and then come back home. And then hand washing, particularly important right now as well. We have to deploy all of those tools together, but it starts on the foundation of vaccination. New York City is in a good place, but we have to drive even further.
And then, thank you. As a follow-up.
Yep.
As a follow-up, do we have any knowledge as to whether these 5 cases were related? It sounds like the Suffolk County is not to the
Okay, we've been listening as the mayor and the governor there telling us what we expected. Omicron, the variant, is in New York State, telling us that 5 cases are in New York, 1 in Suffolk, 2 in Queens, 1 in Brooklyn, and another one in the city. They're not specific on exactly where that is the case. They said the case in Suffolk is a mild one. They believe the other cases are as well. They're just getting this information within the past hour, and they're letting the public know. But the main thing they're telling us is to get vaccinated, get a booster shot, mask up, and maintain social distance as we have throughout the pandemic.